I think we're going to go ahead and get started. Thanks for joining, everyone. I'm Robin Mangren-Scott, Vice President of Marketing and Communications for Dignity Health Central California. And we want to welcome you to the first in a series of webinars in partnership with Dignity Health, the Bakersfield Chamber of Commerce, the Kern County Department of Public Health, the Hispanic Chamber of Commerce, and the Kern Economic Development Corporation. This webinar is designed to bring you the most up-to-date information on the new normal in healthcare here in Kern County, and hopefully answer some of your questions that you may have as we manage through this pandemic together. So, a question and answer session will follow immediately the presentations that you're about to see, and we have a panel of experts joining us today. And we begin today with Bruce Peters, the President and CEO of Mercy Hospital of Dignity Health, Mercy Hospitals, Bakersfield. Bruce?
Okay, good morning, everyone. Thank you for being on the call. We hope you find this educational and helpful as we continue to navigate through this pandemic. This is an unprecedented time for all of us. I know many of you are in a tough situation with your businesses, and, with your families, and what's going on in the community. So we hope you get some good information from us here this morning. I would like to say, just in starting, thank you to all of the people who have been supporting the hospitals. Your support that you've given us has been tremendous. Many of you on the call today have provided food and masks and other things in support of the hospitals, and we really appreciate that. So today I'm going to take you through first the agenda. Next slide, please. First, we're going to have a welcome and a reflection. Back it up, Fabiana. Can you back up to the agenda, please? There. Okay. The welcome and reflection and the COVID-19 current state update. Talk about the new normal, surgeries and elective procedures, treatments and clinical updates, safety assurance, and then finally some questions. Next slide, please. If you have questions along the way, we do not have the chat box enabled, so if you do have a question, please email them to the address on your screen. It's Fabiana Rienzo at dignityhealth.org. Next slide, please. So the panelists today, we have Ken Keller, President and CEO of Dignity Health Bakersfield Memorial Hospital. Myself, Matt Constantine, Director of Kern County Public Health. Dr. Hamel Cothry, Chief Physician Executive, Dignity Health Central California. Not sure Dr. Lee has made it. He is the Director of Cardiology at Dignity Health Bakersfield Memorial Hospital. Dr. Chris Hamilton, Chief of Staff, Dignity Health Bakersfield Memorial Hospital. We have Terry Church, Chief Nurse Executive for Dignity Health in Central California Division, and also at Bakersfield Memorial. And here in the room with me, Amy Olson, Chief Nurse Executive, Dignity Health Mercy Hospitals of Bakersfield. Next slide, please. That's me. Next slide. So we open all of our meetings at Dignity Health with a reflection to ground us in our focus on the challenges of the day. So today's reflection, even though there are days I wish I could change some things that happened in the past, there's a reason the rearview mirror is so small and the windshield is so big. Where you're headed is much more important than what you've left behind. I think what this reminds us of is the opportunities that lie before us in the wake of this crisis. We've learned so much about each other and the priorities that we should be focused on in days, weeks, and months ahead. We as an organization recognize the disparities when it comes to serving our most vulnerable populations. And we've been so blessed by our community and how we all pull together to support our first responders, local businesses, and those who need us most. We thank you from the bottom of our hearts for everything that you've done to inspire this work in healthcare. I introduce our next speaker, one of the leaders who continues to make tough decisions needed to keep us safe and guide us through this new normal. This is the Director of Public Health Service for Kern County, Matt Constantine. Matt?
Good morning, Bruce. Thank you. Are you able to hear me okay?
Yes.
Thank you for the introduction. Thank you for allowing me to participate. This is obviously a very critical period of time for all of us. This is when we all need to pull together and work towards this significant issue that's in front of us. Just to give you some current statistics, we have 34 new cases of COVID-19 that were diagnosed that we're reporting out this morning. That brings our total up to more than 1,500 total cumulative cases. However, we have the far majority that have either completely recovered or are recovering at home. In fact, 96% of those Kern County residents that have been impacted by COVID-19 have either completely recovered or are recovering at home. So that's fantastic news. We do currently have 33 that are hospitalized, and unfortunately, we've had 25 deaths associated with COVID-19. It is important to note that 13 of those 25 deaths occurred at two skilled nursing facilities, at one of two skilled nursing facilities. Obviously, that's a vulnerable population to us, and that's where a lot of our resources are currently being used. It's important to note that there's a lot of work ahead of us. Some of the modeling that the state has released indicates that the cases may continue to increase. Although the efforts of our community have been dramatic, we've all seen the effects, we've all seen the work we've put into it. We have seen our cases stabilize. We're at 33 and a half new cases a day. Our hospitalization rate is stabilized. So those are some good figures, but we do not want to take our efforts away. We are talking in the county in the coming future about allowing some businesses to open under the governor's order, but there's a lot of work ahead of us, and there may be some tough times still ahead of us. At Public Health, we have been engaged in all aspects of our response. We have our Department Operations Center, which means we don't have anything else we do except all of our focus on ensuring our community is safe. That has been in operation for more than 9 weeks. And we have about now 70 public health employees that are doing contact tracing, following up with those that have been impacted, determining if they have actually come in contact with anybody else that we need to help with. The county now has identified 51 testing sites that are throughout the county, which is just terrific. All of our local hospitals are actively engaged. We've actually have some state-sponsored testing sites and now some county-sponsored testing sites. And the idea is that if we can provide early notification of those that are impacted, we can take early intervention to perhaps further mitigate the spread of this disease. So testing has been really ramped up, and we actually have 2 more sites coming online this week alone. As I mentioned before, the skilled nursing facilities in Kern County, which are regulated by the state, there's 19 of them. They care for some of our most vulnerable residents. And we have become concerned about some of those locations. They're state regulated, so the county is not typically involved, but we have stepped up. These are our residents. The employees live here. We need to make sure we're caring for them also. So we're actually doing an unusual effort, doing some sampling ourselves of employees to try to ensure that they remain healthy and active and that they can provide the care to our skilled nursing facility residents. We've also established an alternative care site in the worst case example where we do experience a surge and our hospitals are overrun. We have actually set up a field hospital at the fairgrounds that can accommodate 250 people. So our hope is that we will never reach there. Our hospital partners have been terrific. Dignity has been a wonderful partner. We have a tremendous amount of capability. We have a tremendous amount of resources staged. And it's really an unusual working relationship because it is so positive and so coordinated, and we're focused on just ensuring we can prepare for the worst if it comes. And finally, there's been a lot of attention recently on the governor's roadmap to reopening. The governor has 4 stages, as I think everybody has identified. We entered stage 2 recently, and that allows some curbside retail to occur, some limited reopening. The governor did, though, identify a path for those counties that have done a lot of extra work to ensure the protection of their community, to apply and to get permission to expedite our process through stage 2, because the governor identified now several phases within the stage itself. So we're all at the first phase. On Tuesday afternoon, we did submit our request to the governor to allow the county to have local control and to expedite our run through all of stage 2, in hopes that we could allow our restaurants and our retail operations to open back up with some modifications, with some safety measures in place. They're looking at that, we think, today. We're hopeful we'll hear answers soon. There's a lot of work still to be done. Stage 3, the governor's identified, includes personal care businesses like hair, nail salons, gyms, entertainment venues like movie theaters, sporting events, and religious services, churches, weddings. Those are still in stage 3. And the governor has indicated that we, as a state, will enter stage 3 together. So again, still some work to happen, but we've made a lot of progress. As we are talking today, there's a lot of new normals. We got to change how we do things, and it's going to take all of us. But this is what Kern County does well. And this webinar is a great example where we all pull together, we all do what we can to protect each other, all for the purpose of making sure that we're all safe and healthy. Robin, I think if I'm not mistaken, I'm going to kick it over to Ken. Was that correct?
Yes, let's introduce Ken Keller. He is the president and CEO of Memorial Hospital. Welcome, Ken.
Good morning. Quick mic check. You guys can hear me all right, correct?
We got you.
Okay. Thanks. First of all, thanks to Matt for his leadership as we've been undergoing. There has been a tremendous amount of activity and support from Matt Public Health as well as the county in providing the hospitals and the local healthcare providers guidance, and the partnerships that have been created have been tremendous. The messaging that I have for today, if you push forward one slide, the messages that I have today really come in 3 key points. I'll talk a little bit about it, but more specificity will come from the nurses in terms of some of the tactics that we've undertaken specifically here. The first message is the bug that is COVID-19 has instilled a tremendous amount of fear, basically because of uncertainty and the unknown across the world, really. And that's impacted everything that we know, from the cultural aspects. We no longer can really shake hands comfortably like we used to do 2 months ago. It's affected our economy. It's affected the industrial capabilities. And each one of us independently, personally, have been impacted as a result of people that we know, questions that we have, things that we've seen or heard. And so one of the things and one of the outputs of this conversation this morning is hopefully to be able to alleviate some of the fears of the second major question, and that is the safety of being able to see providers, physicians, other healthcare providers, and hospitals as well. And this new normal that you heard about includes a tremendous effort on the part of all providers to really go an inordinate and I'll say substantively different in the safety aspect to make sure that the patients that we're taking care of that don't have COVID are safe. We still deliver effective care. We still provide the quality of care that's provided. And simultaneously as doing that, making sure that we have the capacity, the processes, and the safeguards in place to care for the patients that are affected with COVID-19 within the settings that we can segregate, separate, and isolate those patients from the rest of our patients, both in the outpatient world as well as in the hospital. One of the things that's been a landmark change within healthcare is typically we're not very adventurous in adopting new technology and in adopting new processes and workflows. We tend to be incrementalist and evolutionary in our care processes and in our changes. But literally over the last 4 months, we've seen a revolution in new things that have been applied in trying to make sure that we present safety, that we present quality, and that we present ways to be able to interact with patients in an environment that helps them to feel secure. So a lot of new things have really taken place. Part of it is in, I'll say, response to the COVID crisis, but also part of it's in response to meeting the needs that are here in the communities. As an examples, the advent and the very rapid adoption and use of things like virtual healthcare visits to physicians, whether that be telemedicine, which is a phone call primarily, whether it be virtual visits through processes and technologies similar to WebEx or Zoom and some of the other things that have been adopted. The rapid escalation of that type of use to do screens, to have primary care type visits, to do histories and physicals, as well as some diagnostic capabilities, has been something that's been light speed adoption on the part of the providers being able to do that, and equally light speed adoption on the part of patients to accept that that is a new method and a new process by which healthcare can help to be delivered. As we've been doing that in part of the stopgap measure, we've also been backstopping with new care processes when you do get to see a patient in real life at the hospitals and in physician offices. We have taken extraordinary steps in re-cleaning, re-disinfecting, in meeting people at the door and making sure that everybody is wearing masks to secure their safety and other ones. So the message comes back to the second point of safety is, initially it was already embedded, but we have gone above and beyond and in exponential focus in continuing to take that peace process forward. The other thing that the third message to drive home today, hopefully, is while there's a question in the balance of if I go see a physician or healthcare provider, what's the impact for me for COVID? There's still a lot of people out there within Kern County, within Bakersfield, that are vulnerable because they have chronic conditions, whether that be diabetes, whether that be some type of heart condition, whether it's been ongoing, lingering joint pain because they put off the delay for getting a knee replacement done or something to that effect. The message is make sure that you don't wait too long. It's safe to get in front of your physicians and get those types of things done. If you have a question, reach out to the physician, reach out to a primary care doc, reach out to us at the hospitals to help answer some questions rather than simply delaying care, because one of the things that has resulted one of the results is people are not seeking care timely and appropriately. And now when we have a patient present to the emergency room, they're in a far more debilitated state than they should be because they've been delaying offset of care that could prevent some other tragic conditions. So the messages today are, number one, make sure that we're providing you information to alleviate some of the fear and address some of those questions that may still be lingering out there. Number two, the New World Order, as it's called, and the new normal that you're hearing about has been proliferated through physicians, hospitals, and others to significantly enhance the care processes and the safety and efficacy of what we're doing in delivering that care. And number three, don't wait too long to intersect and seek care as you may need it. More detail will come as we continue to unpack that throughout the course of the next couple of presenters. And it's my pleasure to introduce next is Dr. Himmel Cothry. Dr. Cothry is our Chief Physician Executive for the Central California Division of Dignity Health. And he has some additional specific information for you.
Perfect. Well, thank you so much, Ken. I appreciate the introduction. So I think we start off real simple with why this virus is so aggressive, why we're so worried about this initially. And the biggest reason is this is the first time this virus was found in human beings. And what makes this virus really interesting is when it infects people, it does it at a more aggressive rate than the typical virus, even the flu virus. It's a lot more aggressive than that. The other typical piece about this is there's a lot of people walking around with this virus that are asymptomatic, and that's what makes it a little scary for us. So those asymptomatic patients, people can pass it on to other patients and other people and infect them. And when you do get these symptoms, initially we thought it was cough, shortness of breath, and some chest tightness, and it's evolved. It's since been morphed, and now you can have pretty much any symptom that can qualify you for this. What has happened is a lot of these patients end up in our hospitals, and the bad part about this is about 60% of these patients that end up in our hospitals end up in our intensive care units, so they get sick very fast. And so what we've been doing now is, since all this started, is we've been looking at different treatment approaches. I think all of you have heard about the common treatment with hydroxychloroquine. That was the first one that was made famous. Everyone started using it. And what we did is we used a lot of studies from China. What they did in China is they used hydroxychloroquine with a medication called Zithromax. You probably have heard of that, locally commonly known as the Z-Pak. And you're thinking, well, why would you give an antibiotic for a virus infection? Well, the simple reason was the hydroxychloroquine was going to stop the virus, but what the virus also did is it caused a lot of inflammation. And the Zithromax has properties that have anti-inflammatory effects on the lungs primarily. So we did the combination. So there were some studies that came out of China, very promising. We started using that, and as additional studies came out, then we started seeing some bad effects as well. We also found that these medications, when used in people that were on ventilators, they stayed on ventilators a lot longer. They didn't do as well as people that weren't on ventilators. So we've morphed from that. We also brought remdesivir. Gilead started a clinical trial with remdesivir. By the time we got these cases in Kern County, they were already full. They didn't have any more research spots. That's been one of the bright shiners so far. There's been a lot of good studies on remdesivir, and what that does is it actually works very similar to a drug that a lot of us know of called Tamiflu, except it is in an IV form currently. And what it does to this virus is it shortens the course of the virus and decreases the severity of the virus. It doesn't cure it per se. And so we've been studying this, and what we found, the biggest issue with this virus is inflammation. It causes a lot of inflammation, which will cause the lungs to scar up like you see in the picture currently, but it also causes inflammation and affects other organs as well. We've heard a lot of people have heart attacks and strokes because of this virus as well, because it attacks those organs. Since then, we've now come up with new drugs, older drugs that we're putting back into treating these. still ongoing research. One of the most common ones that we're using currently is a medication called interferon that we've used in the past for chemotherapy, which seems to help with this antiviral effect, and we combine it with a medication called ribavirin. And the two in combination seem to have cut down the progressiveness of this virus. None of these have worked as well as we'd like to. We're still ongoing. We're doing more research. We in Bakersfield are actually going to launch a research project ourselves that we think we might be able to help as well. But the one shining light, if you will, the one treatment that has worked and has worked really well and has had no negative side effects so far is our convalescent plasma. We worked with our local Houchin blood bank to treat these patients with convalescent plasma. And what that is simply is a patient that has been affected with the COVID, after they're cured, we take their plasma and we use the antibodies that they've made to then put it back into someone that has the virus, and hopefully these antibodies will help fight off the virus. And we, not only in Kern County, we were the first in Kern County to transfuse a patient with this plasma, but we actually have been using it across the country and have had really, really good effects. And if you can go to the next slide, I'll show you a quick picture. The x-ray on the left is a person that was on a ventilator for over 25 days. The x-ray didn't change too much. We then finally got this convalescent plasma. It was hard to get because we had to have people recover and then donate the plasma. And if you see the x-ray on the right, you don't have to be a medical professional to see that's the x-ray of the same person 3 days later. A day later, we extubated the patient, took him off the ventilator, got him back to the floor, and this patient is now at home. So you can see the dramatic difference in the images, and that's the one thing that we know works. We know it works all the time. Well, it works majority of the time, and there's no downside to it. So the one thing that I would ask from all of you is if you know anyone that's had the COVID virus and has recovered, is to go out to the Houchin Blood Bank and donate the plasma. And it really does help all of our patients. The one other question that we get quite often is has to do with elective surgeries. And the two biggest questions we get is either with orthopedic surgery or heart surgery. When can I go in? When am I safe to go in and have these procedures done? So today we also have on here Dr. Christopher Hamilton, who's the Chief of Staff of Memorial Hospital, and Dr. Tommy Lee, who's the Director of Cardiac Care here at Memorial Hospital, to help address these issues a little bit further.
Good morning. Can you hear me? Good morning.
You're good.
Yes, we can.
Good. Can I have my first slide, please? I've been asked to make a few comments about the treatment of heart patients during our pandemic. There's been a lot of chatter recently in doctors' social media about the drop in STEMI activations across the country. STEMI patients are patients who present with symptoms of a heart attack. The first EKG shows abnormalities suggestive of a heart attack. The emergency room then activates the STEMI team, which is a quick reaction force of doctors, nurses, and techs to converge at the hospital in order to treat these very sick patients. So what happened to all the STEMIs? Next slide, please. The answer in part may come from the CDC. This agency keeps track of all the deaths in the country, and through statistical modeling, they're able to predict the number of deaths. So when you see more deaths than expected, it may be an indication of a new disease outbreak. Here's a plot of the expected deaths from January to April of this year. As depicted in the dotted line there. The solid line are the observed deaths. There is pretty good agreement between the dotted line and the solid line until mid-March. The solid line then skyrockets. Well, duh, we have a pandemic and people are dying from this deadly virus. But take a closer look. The deaths due to COVID-19 is depicted in the dark shaded area, and the lighter shaded area are people who die from other causes. Looking at the total deaths, COVID can only account for 60% of these deaths. So what makes up the other 40%? It may have been more accidents. People have more time on their hands, decide to climb up on the roof to wash their solar panels. Maybe a couple falls there. Maybe more suicides. Some places there's sick patients who couldn't get into the hospital because the hospitals were full of COVID patients. Or maybe patients were sick and afraid to go to the hospital because of COVID patients. So whatever the case, these excess deaths in the light shaded area are just as important as the COVID deaths in the dark shaded area. You can even argue that the excess deaths are because of COVID. So that's in the US, but we're not alone. Next slide. This is an analysis published in the Financial Times earlier this month. We see the same phenomenon. The pandemic results in a spike in mortality across Europe. Like the US, the COVID deaths make up only a part of that spike. So excess deaths, where are they coming from? Next slide. This is a small study from 9 large cardiac programs across the US. They looked at their STEMI activation data. On average, this group saw about 24 activations per month before the pandemic, and it fell to 15 after the pandemic. This is a 35% drop in patients with heart attacks. So the virus cures heart disease? The authors had a different explanation. They believe this drop is the result of the shelter-in-place order across the country. By having people stay at home so they don't catch the virus, we suffer the unintended consequence of having people who have serious illness not seek medical attention. Heart attack patients either died at home, or those who survived were brought to emergency rooms with heart failure, ruptured heart valves, or lethal arrhythmias, and then ultimately death. So what should people do? Next slide. Well, they should not ignore their symptoms. When in doubt, call your doctor. We don't do house calls anymore, but we sure can do FaceTime, Zoom. The hospitals and offices are doing extraordinary things to keep their staff safe and their patients safe. Next slide. They rigorously screen everyone that enters. Our office screens every doctor, nurse, and MA every day with questions and temperature checks. Every patient gets screened with a text questionnaire and then again at the door with questions and a temperature check. Next slide. The virus is spread person to person by droplets. Therefore, social distancing is an important measure we take against this virus. By limiting the number of visitors who may come with a patient and by limiting the number of patients we see in an hour, we can avoid crowded waiting rooms like this one in order to maintain social distance. Next slide. This virus is very sneaky. Many individuals are carriers. They're asymptomatic, yet they can be shedding virus all over the place. Universal masking in our office and hospitals significantly limits the spread. All our doctors, staff, and patients are masked. Next slide. This virus is resilient. It can live on surfaces for days. Sanitation routine in our office, and I'm sure at the hospital as well, is more stringent than ever. Every surface that a patient comes into contact with is cleaned immediately after the patient leaves. Next slide. Finally, this is for Dr. Constantine. We have to have perspective. The COVID cases in Kern County as of Monday was 174.1. That is, we have 174 cases of COVID per 100,000 persons. Doing the math, that is 0.174 per 100 persons. So what are the odds of sitting in a room with 10 people that one of them is an asymptomatic carrier? Next slide. To go or not to go? We don't have a cure for COVID, but we sure do have very effective treatments for heart disease. So weighing the risk for contracting COVID versus the risk of being an excess death, I say chances are better for getting that care that is needed for today's hospitals and medical offices with their heightened screening for COVID patients, their visitor gating policies to ensure adequate social distancing and universal masking. Also, their fanatical sanitation protocol is aimed to keep everyone safe. Going forward, I suspect this concept of excess deaths will drive many policy decisions, not just in city halls or the halls of Congress, but also in the hallways and living rooms of many homes around the world. Well, that's just my opinion, and I'll leave you with that thought of excess deaths. I think Chris is next, right?
Yes, Dr. Hamilton's joining us with Southern California Orthopedic Center, SCOE, and he is Memorial Hospital's Chief of Staff.
Hi, can you hear me?
Or can.
Okay, thank you. It's a pleasure to be here. Most of what I was going to talk about, Dr. Lee talked about to a degree. I would like to say that there's been some perspective as well. It's not a normal time. I think we are all looking at the importance still of practicing social distancing. One of the biggest questions that gets asked from an orthopedic standpoint is, I think two things. Number one, is it safe to come to the office or not come to the office? And I think the hospitals and the outpatient clinics have done an incredible job of making sure that we are protecting both our staff and our nurses who have gone above and beyond, who want to give care and want to take care of people, and then being very prudent in protecting each other and our patients. One of the ways we're doing this is through fairly extensive testing. And so, for instance, if you're going to talk about having a semi-elective, and I think you do have to differentiate what's truly elective, especially in somebody who's young and healthy, is a little different than something that's truly elective in somebody older with more medical problems. In the orthopedic realm, we have lots of stuff that's urgent but not emergent. So if you break your ankle, go to the hospital, get taken care of. Go to the surgery center, get tested, be taken care of, and get better. The therapist will still see you. You can still be treated for your acute injuries. We have more things that are a little grayer. So unlike Dr. Lee's comments, we actually are seeing less injuries. We don't have any youth sports. We're not seeing as many car crashes, although that number has started to go up just over the last week or two. People aren't driving. And you have to remember that as a whole, we did no elective surgery for nearly 6 weeks. So we have a lot of people, probably 70 of personal patients, that we canceled to put off their surgery as being not detrimental to wait a month or two. But what happens is you have to then weigh the risk of waiting a month or 2 months for a semi-elective orthopedic surgery procedure. For instance, if you can't walk and can't take care of yourself, and that leads you to not be able to exercise and increase your risk of heart disease, maybe there are some orthopedic things, whether it's replacing your knee, taking care of your rotator cuff, you should think about. It's going to be different. We are limiting our visitors. So you can't have 6 people with you, but that's how we do social distancing. We have been taking care of fractures. Again, part of the reason we limited the elective surgery was to ensure that if there was a hospital surge for PPE, that we had enough equipment for the nursing staff so that if you were sick and the virus were around more, we would be able to take care of you. I think we are still looking at our surgeries very carefully to recognize that if we see a spike that I think we all are a little worried about, that we can ratchet back the elective cases and be a little more careful about what we do so that we are here to take care of other cases. I think the nurses are going to talk to you a little bit more about how carefully we're trying to keep places COVID-free versus where you treat patients who have COVID. One of the ways that's doing that is steering some of the less emergent cases to surgery centers, Millennium or Bahamas, where we're carefully testing and screening all our patients, protecting our staff, being very careful about how we control your airway for droplet preservation, And right now, at least, we've had no cases in Kern County of transmission from a healthcare provider that we know of. So I think we're still very careful to protect the vulnerable patients. If you're older and you have more morbidities, you may come into the office and look at non-operative treatment, but don't completely put off your treatment if it's going to improve your quality of life. I think the thing that, as I turn this over, is we're doing everything we can to protect our staff. I do not think you're going to get something from any of our staff members. Those cases have not happened. We're being very careful with PPE. I have had a patient who was asymptomatic who was tested and treated and had her treatment appropriately. She required surgery. There was another patient who we know of who was tested, who we were then able to delay the surgery and keep them out of the healthcare environment. So from an orthopedic standpoint, we are ramping back up, being very careful about what we're doing. We're trying to keep you out of the nursing home after surgery. So if there's a chance that you'll need more care or rehab afterwards, we may ask you to delay that. On the other hand, if you can safely do your rehab at home, work with a physical therapist, there's no reason that we can't start to move toward getting some of the other cases where you would be worse off if you waited a month or two to be able to improve your quality of life as well. I think it's passed on to Terry. I believe you're next.
Great. Thank you, Dr. Hamilton. Yes, let's turn now to Terry Church, who's the Chief Nurse Executive for Dignity Health Central California, and Amy Olson, Chief Nurse Executive for Mercy Hospital.
Good morning. Thank you for the introduction. We've heard a lot of stuff. We're going to really talk about more the hospital perspective as we've ramped up for surgeries and elective procedures. What is our new normal inside the hospital? And as you've heard, we've done a lot of things over the last couple of months, and we're going to keep a lot of those things in place to protect the public, so you feel comfortable coming back to our facilities. So the first thing that we're going to continue to do that we've been doing now for a couple of months is screening at our entrances for anyone who's walking through our doors, whether they're a patient, a staff member, a vendor, a physician. They get their temperature taken, and then they get asked a series of questions about symptoms. You have a sore throat, cough, any type of illnesses. And we've actually sent several people home, probably over the course of a month. So not a lot. People have gotten the message to, if they're sick, don't even come in, because we're gonna check you out prior to letting them in the building. We know that safety is probably the number one thing that people want assurances of now, and it's probably been that way even through our patient and family center councils. We know one of the things we hear all the time is keep me safe, don't hurt me when they come to the hospital. So that is one way that we can assure you, if you come to our facilities, that you're not going to get something from our employees. We've also limited the access to the hospital, the entrances at all three of our campuses. So we're funneling people through very limited. So we make sure that no one will sneak in, and everyone that will get that screening at our entrances. And then lastly, universal masking. Dr. Lee also talked about this. That is, every single person that comes into our hospital at the front door has to put a mask on. So we're asking patients and families to bring their own, and if not, we do provide that mask for them at our door. And they're to wear their mask if they're a patient or a family member anytime they're in contact with a physician that comes in their room, or a nurse, or whoever, lab comes in and does something. We want them to wear their mask, again, so they can protect each other. We protect the healthcare worker, doesn't transmit anything to the patient, and then the patient doesn't transmit anything to our caregivers. Again, we want to keep both populations healthy. Anytime a patient is out of their room, they're going to imaging, x-ray, they're walking out in their hallway, which is really important. We want to maintain people being ambulatory so they don't get any illnesses from being in bed too long. And so they also wear their mask during that time. So I will turn it over to Amy, who will talk about a couple more things that we're continuing to do.
Next on our list is social distancing. So as in the community, when individuals are out, we're encouraged to maintain that 6-foot social distance. In the facilities on our 3 campuses, we're maintaining that 6 foot as well. So if you're in our facilities, you'll see additional signage around the campuses as well as on the floors to indicate the 6 feet for the appropriate social distancing. And as we learn more information, then our signage will also change to increase our communication with our visitors and our patients. And we have had limited access to the hospital like Terry talked about, and that has impacted the number of visitors that our patients have been able to have in the facility. And over time, we have determined avenues to improve the communication with our patients, with their families, so that way they do not feel left out of the loop. And they also maintain that communication is very vital to our patients and their recovery. So one of the ways that we have done that is the use of technology to enhance our communication with the patients as well as their families. So we have guest Wi-Fi available for our patients and their families if they're with the patient. And we also have the ability to use FaceTime, Google Duo, Facebook Messenger, and Skype to help our patients connect with the families while they're here with us. Next slide, and hand it back to Terry.
Thank you, Amy. And we know all these things that we just talked about are difficult. We're very social creatures, as Keller was talking about. So it's very difficult when we have people that are sick, when you can't visit them. But when we talk to people about it, they really are understanding and trying to protect their loved ones who are already sick or have had a procedure from actually getting COVID or something else. There's other viruses and they're also going around. So it may seem rather hard, but it is probably those strategies or those effective things that we have to keep safe and we come to our facility. So I'm going to go to the next slide, and Dr. Helm talked about this a little bit on the testing of all our procedures. So they're going to come to our facilities and have procedures or surgery, you're going to be tested. And at Memorial, we're actually doing a little drive-through, so you're on a procedure, and staying in your car, and it usually affects our workers. We do your swab right there in your car. We ask you to isolate in your home until you have your procedure because the virus is now community acquired. So we want to make sure that you don't acquire the virus between the time that we swab you and you have your surgery. And Amy, you want to?
Sure. And at the Mercy campuses, we do not have the drive-through option for our current setup, but we do have additional wayfinding signage that has been put up to assist our patients and their family member for the pre-testing and the day of their procedures at both the downtown and Southwest campuses.
Thank you. You can see we also established COVID, what we call COVID-free zones. So if you come and have a procedure at our hospitals, you're not going to share a floor with patients that are positive for COVID. As you heard Matt Constantine say, we still have COVID patients that are hospitalized. So what we've done here at Memorial is we have 2 units that are small, and we've dedicated those to our COVID positive patients. And that staff is dedicated to that area. They don't go take care of other patients in that same day. So again, trying to segregate those so we can make sure our other hospitals, which our other patients in the hospital, which are the majority of our patients, are not ever going to actually encounter a COVID positive patient during their stay at our facility.
And then for the Mercy campuses, having the 2 facilities in both the emergency departments, our intensive care units, and on our med-surg tele units for both Southwest and downtown, we do have dedicated areas for our COVID positive patients or patients under investigation based on symptoms and presentation. And then as Terry discussed, we also have dedicated staff for those COVID positive patients and patients under investigation until we get the test results back. and are concluded that they're not COVID positive. And those staff members don't go into other patient care rooms. And to support that process, and with the identification of this COVID virus, we've identified the need for enhanced cleaning. So we have enhanced cleaning on high touch surface areas like doorknobs, light switches, and those types of things. But we also have increased cleaning in common areas, such as the waiting rooms. Even while we're maintaining that social distancing, we want to make sure that those areas are cleaned often and that the next patient or visitor in that space is safe as well.
The next slide. So basically, we have capacity in all of our emergency departments, our surgery departments, and our hospital. So we hope you've given you an overview of everything that we're doing to keep you safe, so you don't feel like you have to stay home while you're having a heart attack, a stroke, or you just need care. We don't want you to delay that. We want you to come into our facilities and feel very comfortable.
Great. Thank you so much, Terry and Amy. We appreciate your comments, and thank you to all of our panelists. Now time to take a couple of questions. We have about 9 minutes. We have received a number of questions from the community, and we're going to start with this, and I believe that probably Terry or Amy should be answering this question. If you want to ensure your hospital is safe for patients, should your staff be tested on a daily or weekly basis to ensure that they're COVID-free? Is there a plan to universally test all hospital staff?
That's a really good question. Not at this point in time. Basically, and that's why it's really important and why we're screening at the front before they come into the facility, so we make sure that don't have a temperature or any symptoms. It's probably not practical to be tested every day, and we actually don't have enough even testing materials to do that right now. But even if we did, probably the most that you would want to test is every couple of weeks. And at that point, it's really not even recommended yet, though I do know the state of California is looking at their recommendations.
Okay.
But that's why we're doing the universal masking, though, also to, if someone does have something, then, at least they have a mask on so they won't transmit that to someone else.
Thank you, Terry. This question is for Matt Constantine. You mentioned what's being done initially for safety in nursing homes. What are you doing with other departments to ensure safety for nursing homes throughout the county?
So, Robin, I'm sorry, I don't quite understand the question about other departments. Help me, I want to be able to answer the question.
I think what they're asking is whether or not you're working with other departments, perhaps an investigation that might be going on with the district attorney's office, that type of thing.
Oh, yes. Thank you. I understand that. So the state has primary regulatory authority over all of our skilled nursing facilities. Doesn't normally interact on a daily basis from a county perspective. But we have, in an uncharacteristic manner, engaged because we want to make sure they have adequate staffing. We want to make sure that the residents are cared for. In fact, I have a big conference call with the state this afternoon on just this. Our primary issue right now today is ensuring their protection. So we're not going to talk about work reimbursement. We're not going to talk about resources. We're going to give everything we need to make sure that our most vulnerable are protected in these skilled nursing facilities. So there's a lot more work to be done. There's a number of facilities that are still affected, but we're on it, and we're going to do everything we can to help.
Thank you, Matt. This is for Dr. Cothry. A resurgence of COVID is expected again in the fall. With the public beginning to move on with life as normal, shopping, etc., what can we be doing to continue to protect ourselves?
So I think a couple big things. As long as we can maintain some of that social distancing, I think that's been shown and proven to help. prevent the spread of this virus, because we all know it's coming back. The other big thing, which is a really simple thing that we've been taught ever since we were kids, is our hand hygiene. You know, we've got to keep our hands washed. We've got to keep our hands away from our faces. We've got to not cough out in the air. We got to cough in our elbows. Some of those real simple things can not only help prevent the spread of COVID, but the spread of a lot of the other viruses and stuff that will be coming around this fall as well.
Okay, thank you, Dr. Coffey. I think, Matt, this question you might be able to answer this. Has the hospital or the county seen an increase in child abuse cases in our community since the shelter in place was established?
So, Robin, I can't specifically address that from a public health standpoint. I know there are concerns that by the stay-at-home order that the governor has issued, it does have impacts. I think, as Dr. Lee indicated, there are other issues that develop because of this, and I know those statements have been made. I know that it's being tracked carefully. I don't have specific information today. I think we're early on, but I think it's relevant to take into consideration all of the impacts that this
How do you
has.
find the best, most qualified short or long-term staff for your medical facility? Century Health Staffing Services provides highly qualified consistently high-quality service standards for all of our employees. At Century, we take pride in the dependability, integrity, respectability, and efficiency of our healthcare professionals. We invite you to hold for just a moment to learn more. We'll be right with you.
Let me mute everyone. Who was it? Natalie? Okay.
Good job.
Let me see if I can unmute Matt here.
And I can unmute myself.
There we go.
There you go.
Thank you. If you would just finish that your answer to that question.
I'm sorry, I don't know where I got cut off, but remind me.
Okay. Well, I appreciate that comment. But while we have you on the line, another question coming in. Is the Public Health Department open for services like shingles, flu vaccination?
Yes, ma'am. So this week, Monday, the county started to phase out the essential workers restrictions. So beginning this Monday, public health has begun to reopen slowly over time as the hospitals have protocols in place. So does public health. So there will be a little bit of some delays as we ensure that our staff and the public is protected, but we are open for business.
All right. Thank you very much, Matt. And this is for either Ken or Bruce. Kern County appears to have flattened the curve and never truly experienced the surge seen in other parts of the states and countries. That said, health experts say that we can see a significant wave this fall. What are hospital leaders doing right now to ensure your facilities have the equipment, processes, and testing needed should there be a surge in the fall?
Well, I can start, and Ken, you can fill in. So we've learned a lot through this initial period, which means we have developed policies, procedures, other guidelines to help us contend with that. And I think that sets us up really well for the future, because now we know what we're dealing with to a large degree. We continue to stock supplies. It's been mentioned before, there initially was a shortage of personal protective equipment, face masks, shields, gowns, etc. So we are making sure that through all of our supply chains that we're getting enough personal protective equipment in, making sure that we have enough ventilators if we get to the point that we need more of them. But largely, I think we will be prepared and will be capable of handling any kind of surge in the fall and in the winter.
All right. Ken, did you want to respond to that?
Yes, ma'am. I'll go ahead and tack on just a little bit, and then if it's okay, go ahead and close now that we're just right at the top of the hour, half of the hour. The other thing is, as we've done the coordination amongst all the hospitals within the county has been tremendous in helping us to plan as a community, sharing resources, sharing information, working through Matt and team has been beneficial to this. And that takeaway and learning extrapolated to the potential for whatever comes in the fall is going to position us well within Kern County as well as within Dignity Health, knowing that we have the ability to share supplies, cross-reference tools, and those types of resources as well. So if it's okay with the team, I'll go ahead and close with three pieces, three things as usual. The first is we hope that today was informative for you guys. My belief is that this is just a piece of the ongoing conversation that we'll continue to have going forward. So please don't hesitate to reach out. If you have follow-up questions, please contact us and I'll offer any of us to provide additional detail. Secondly is, as we were informing you, part of the ask is provide this information to your teams, your staff, your workers, your cohorts, and your colleagues, knowing that this is being replicated within Dignity Health, within Mercy Memorial Hospitals, as well as throughout the other hospitals that we're aware of. And third is, if Fabiana goes back to the one slide, a tremendous thank you to the community, the support that we've received, that our caregivers have received, the gifts, the food, the prayers, the good words is a tremendous value and is motivational to us. So on our behalf of the teams at Mercy Memorial Hospitals, thank you for the support of Kern County. We greatly appreciate it. It is what props us up on a daily basis. And with that, I'll kick it back to Robin to close.
Thank you, Ken. You said everything I wanted to say. We just want to thank all of you for joining us, and we look forward to another webinar to update you on the very latest on the new normal in healthcare here in Kern County. Thanks, everyone, and have a great day.
Have a great week.